In a stunning blow to Senate Republicans, Senate parliamentarian Elizabeth McDonough has rejected critical Medicaid provisions in the GOP's ambitious Megabill, throwing their strategy to slash federal spending and advance President Donald Trump's agenda into disarray. The ruling, announced on June 26, 2025, at 11:21 a.m. Central Standard Time, jeopardizes the One Big Beautiful Bill Act, as Trump's July 4 deadline looms, potentially derailing a planned Senate vote this week. The centerpiece of McDonough's decision was the rejection of a proposal to cap states' use of healthcare provider taxes, a mechanism states use to secure additional federal Medicaid funding. This cap was projected to save hundreds of billions of dollars over the next decade, funds intended to offset the cost of making Trump's corporate tax cuts permanent. A Democratic summary states the provision violated the Byrd Rule, which ensures budget reconciliation bills, passable with a simple majority of 51 votes, focus primarily on budgetary matters rather than policy changes. The ruling has forced Senate Majority Leader John Thune, Republican South Dakota, to reconsider his strategy for pushing the bill forward. The provider tax cap had already sparked significant pushback within the GOP. Senators Josh Hawley, Republican Missouri, Susan Collins, Republican Maine, Lisa Murkowski, Republican Alaska, and Jerry Moran, Republican Kansas, warned that shifting Medicaid costs to states could lead to the closure of dozens of rural hospitals. Hawley and Collins have not committed to supporting the bill unless GOP leaders devise a plan to protect these critical health care facilities from financial collapse. Senate Democrats, led by Jeff Merkley, Democrat Oregon, the ranking Democrat on the Senate Budget Committee, celebrated the ruling as a major victory. Democrats are fighting to stop Republicans from gutting Medicaid, dismantling the Affordable Care Act and kicking kids, veterans, seniors and people with disabilities off their health insurance, all to fund tax breaks for billionaires, Merkley declared in a statement. He vowed that Democrats would closely scrutinize any GOP attempts to revise the bill, ensuring strict adherence to the Byrd Rule. McDonough's rulings extended beyond the provider tax cap. She also struck down several Republican provisions aimed at restricting Medicaid and Medicare access for non-citizens. One measure would have barred refugees, asylum seekers, and those with temporary protected status from Medicare, even if they met work history, payment, age, or disability requirements. Another rejected provision sought to prohibit federal Medicaid and Children's Health Insurance Program (CHIP) funding for individuals whose citizenship or immigration status couldn't be immediately verified, overriding the existing 90-day verification period. Additionally, McDonough blocked a proposal to reduce the federal medical assistance percentage grant from 90% to 80% for states providing Medicaid to undocumented immigrants under Affordable Care Act expansions. She also rejected a provision banning federal funding for gender-affirming medical care, a late addition that had drawn fierce criticism from Democrats and advocacy groups. These rulings have collectively stripped out over $500 billion in planned spending cuts, according to Bobby Kogan, a former Democratic Senate Budget Committee staffer now with the Center for American Progress. The decision sparked outrage among some conservative Republicans, with Alabama Senator Tommy Tuberville leading the charge. In a scathing post on X, Tuberville called McDonough a woke bureaucrat appointed by former Democratic leader Harry Reid and demanded her immediate firing. The woke Senate parliamentarian struck down a provision banning illegals from stealing Medicaid. She should be fired ASAP, he wrote, decrying unelected officials obstructing elected lawmakers. Senate Majority Leader Thune, however, firmly rejected calls to overrule or remove McDonough, warning that such a move could jeopardize the bill's passage. That would not be a good outcome for getting a bill done, Thune told reporters on Thursday. He acknowledged the uncertainty surrounding the rulings but insisted that the bill still includes significant Medicaid savings. We may not have everything we wanted in terms of provider tax reforms, but if we can get most of the reforms there, this is about saving taxpayers money, he said, hinting at plans to rewrite the cap or find alternative savings. A Republican source familiar with the ruling downplayed its impact, stating, "This is not as fatal as Dems are portraying it to be." The source expressed confidence that GOP leaders would find a solution, possibly by revising the provider tax cap to comply with the Byrd Rule. However, with Trump pressing for the bill to reach his desk by July 4, time is running out. Louisiana Senator John Kennedy defended McDonough, saying, "She's very fair, and I don't think she should be fired." The parliamentarian's role is pivotal in budget reconciliation, which allows the GOP to bypass a Democratic filibuster. McDonough's adherence to the Byrd Rule has also led to the removal of other GOP priorities, such as defunding sanctuary cities and repealing electric vehicle mandates. Her confidential rulings add complexity to an already contentious process.